Hello and welcome. Today we're delving into a common yet often painful condition, urethral calculi, or stones in the urethra. Join us as we explore what causes these stones, how they impact the body, and what can be done about them. So, what exactly causes these urethral stones? Well, in most cases, they don't actually originate in the urethra itself. They typically begin their journey higher up in the urinary tract, usually in the kidneys. These kidney stones then travel down the ureters and become lodged in the urethra. Factors contributing to kidney stone formation in the first place include dehydration, dietary habits high in salt, animal protein, or oxalate, and certain medical conditions like hyperparathyroidism, gout, and urinary tract infections. Rarely, stones can form directly within the urethra due to urethral strictures or other anatomical abnormalities that slow urine flow and promote mineral precipitation. Let's understand how urethral calculi affect the body. Once a stone becomes lodged in the urethra, it causes a physical obstruction. This blockage prevents urine from flowing freely out of the bladder. The backup of urine can lead to increased pressure in the bladder and ureters, causing pain and discomfort. The sharp edges of the stone can also irritate and inflame the urethral lining. This inflammation can contribute to further pain and potentially cause bleeding. Prolonged obstruction can even lead to urinary tract infections as bacteria thrive in the stagnant urine. In severe, untreated cases, backflow of urine can damage the kidneys, leading to kidney failure. Urethral calculi can affect individuals of all ages and genders, but they're more commonly seen in men due to their longer urethras. The overall prevalence is directly related to the prevalence of kidney stones in a population. So, regions with higher rates of kidney stone disease will also likely see more cases of urethral calculi. Factors such as diet, lifestyle, and geographic location, which influence kidney stone formation, also indirectly affect the occurrence of urethral stones. What are the telltale signs that someone might have a urethral stone? The most common and often most distressing symptom is sudden, severe pain in the groin or lower abdomen. This pain can radiate to the penis or scrotum in men. Other symptoms include difficulty urinating, a weak or intermittent urine stream, a frequent urge to urinate, and pain or burning during urination. You might also notice blood in the urine, a condition known as hematuria. In some cases, especially if an infection is present, fever and chills may occur. Diagnosing urethral calculi typically involves a combination of physical examination and imaging studies. During a physical exam, a healthcare provider may be able to palpate the stone if it's located in the distal urethra. Imaging techniques are crucial for confirming the diagnosis and pinpointing the stone's location. A KUB X-ray, which stands for kidneys, ureters, and bladder X-ray, can often visualize larger, calcium-containing stones. However, some types of stones may not be visible on X-ray. A CT scan, or computed tomography scan, provides a more detailed view of the urinary tract and is highly accurate in detecting even small stones. A retrograde urethrogram, where dye is injected into the urethra, can also be used to visualize the stone and any associated urethral abnormalities. Urethral calculi don't typically have a complex classification system like kidney stones. They are often simply described by their location within the urethra, such as the penile urethra, bulbar urethra, or prostatic urethra. The composition of the stone, such as calcium oxalate or uric acid, is also important, but this classification is more relevant to understanding the underlying cause and preventing future stone formation. Treatment and management of urethral calculi depend on the size and location of the stone, as well as the severity of the symptoms. The primary goal is to relieve the obstruction and alleviate pain. Small stones may pass spontaneously with conservative management, which includes drinking plenty of fluids and taking pain medication. Alpha blockers can also be prescribed to relax the urethral muscles and facilitate stone passage. Larger stones or those causing significant obstruction typically require intervention. Urethroscopy, a procedure where a small scope is inserted into the urethra, is often used to retrieve or break up the stone. Shock wave lithotripsy, which uses sound waves to shatter the stone, is less commonly used for urethral stones compared to kidney stones due to the risk of urethral injury. In rare cases, open surgery may be necessary to remove a very large or impacted stone. Preventing urethral calculi largely focuses on preventing kidney stone formation in the first place. This includes staying well hydrated by drinking plenty of water throughout the day. Dietary modifications are also crucial. Reducing sodium intake, limiting animal protein consumption, and being mindful of oxalate-rich foods like spinach and nuts can help. For individuals who have a history of kidney stones, a healthcare provider may recommend specific dietary changes or medications to prevent future stone formation based on the type of stone they've previously had. Regular checkups and monitoring of urine and blood parameters can also help identify and address any underlying metabolic abnormalities that contribute to stone formation. The prognosis for urethral calculi is generally good with prompt and appropriate treatment. Most stones can be successfully removed or passed without long-term complications. However, recurrent stone formation is possible, especially if the underlying causes are not addressed. Recent research is focusing on developing more effective and less invasive techniques for stone removal. Studies are also exploring the role of various medications and dietary interventions in preventing stone recurrence. Furthermore, advances in genetic testing are helping identify individuals who may be predisposed to kidney stone disease, allowing for earlier and more personalized preventative measures.